in here now that the room has thinned out with people, so it's cold back there. I'm Carmen Wiesner, and I'm the Executive Director of the National Association of Social Workers, the Louisiana chapter. And in my other life, prior to being coming to work for NESW, I was the Assistant Secretary of the Office of Community Services, the Public Child Welfare Agency for the state. I worked for the state for 36 years, and I loved every day of that service to the citizens of this state. And what I come before you today is to ask for your consideration for funding for a program for the youth that are aging out of foster care. In 2010, the state unfunded that program. It broke my heart. We had that program for years, and we helped to do a handoff for these children to become independent adults. Young adults, until they're reached about the age of 25, their prefrontal cortex is not fully developed. And so if you have your own children who are in that age range, you think, God, when are you ever going to grow up and begin to make good decisions? It's because the frontal cortex has not developed. So what we do in this state is, once our children who are in foster care, and the state is their parent while they are in foster care, once they attain the age of 18, we say, good luck to you, and you're on your own. They grew up in foster care because they didn't have a family to connect to. So on average, every year, between 150 to 180 children exit foster care every year. So y'all met the last couple of days and last week, 4 amazing young adults. They are the exception to the rule. Most of our young people exiting foster care are 2 years behind in school. They have no skills to get a job. The likelihood that they are going to be able to finish high school is pretty limited. They are at great risk of being homeless. They are at an ever-increasing risk of the correction systems. They have a higher rate of post-traumatic stress disorder than our returning veterans. We have a moral responsibility for these children. And I'm sorry Donahue's not here right now, but I did testify for these children on the other side. I testify every year
as I remember,
for these children. They are my passion. And when I left the department, it's these children that worried me the most, because many of our children that got adopted or were able to successfully return home, those were lucky children. But it's these children that grew up in care, and we weren't able to facilitate those permanent connections that break my heart. 2 years ago, on the House side, House concurrent resolution passed by Representative Billiot brought together a task force that I had the pleasure of being the co-chair of, and we worked diligently for 2 years to pull together a report that was submitted in February of this year to both the House and Senate Health and Welfare Committees. We gave you the data. We looked at other states, what other states were doing for this population, what's the risk for these children, and urge you to consider helping them. Be bold. Be bold. The ask, according to the department, would be about $4.7 million for their room and board cost, as well as the case management services that these children need and that these children deserve. Thank you so much.
Thank you for your testimony this year and all the other years that you've been here. I do believe that the Secretary pointed out that those 4 interns who had aged out were truly an exception.
They were an exception.
That they were exceptional in every way. because they succeeded despite the fact that I think
you talked to them, Senator LaFleur, when we talked to the ones our committee convened, and we told them we thought you're exceptional, and they said, we're not exceptional. We live on a razor's edge every day, and if we fall edge, we're homeless.
Right, and they don't have a huge support network, as we've learned, and we also learned that they each had 6 to 7 caseworkers or people that monitor and during that process, and then and of course when you go through 6 or 7, you don't often get a permanent
right.
And so as a result, you age out, and you age out with as you say, a razor thin network of people to provide the support that you need. So we are aware of it. I'm glad you
I
reemphasize
hope
that.
eventually we restore this funding before I go to the other side. I just feel compelled to say that. I grieve for these children. I grieve for these children.
Senator Hewitt has a question.
I appreciate your passion, and being the newbie on the committee, I haven't been around to have heard your testimony over the years, but I appreciate you advocating for these children. So I just want to make sure I understand your funding point. I understand the need. I'm trying to understand the funding. So do we have programs in place right now? I mean, what I read real briefly, the task force is advocating for some new policy changes and things like that I'm not clear if they are or are not in place yet.
They're not in place yet.
Okay. So I mean, we can't affect the policy through
Well,
funding.
there's a couple of things that are in place. They do, the state does draw down federal independent living dollars, which is some $40 for some independent living services that are provided to these children while they are in care. But in other states where they do continue to support this population, and they've pushed out their state plan amendment to where you could draw down federal dollars until they're age 21, and you may have to make some changes to the children's code to allow for them to remain sort of in a custody situation. So you can draw down federal dollars. What this asks is for state general fund dollars, or for the department to look at leveraging or moving around funding this with Title 20 dollars, which is how we used to fund it with Social Services Block Grant.
Did you say that you're currently with the department, or you're
No,
you're
I'm
formerly with the
retired. I
department?
retired from the department, but I was the assistant secretary with the department for
Okay.
years.
Okay, no, I'm just trying to connect the dots with how they have described their needs, their funding request, and how that matches up with.
This was not
what you're
included.
recommending.
Was not included in their budget request. But just
It's
because
still a
it
big
wasn't,
need. Yes, ma'am.
just because it wasn't included doesn't mean I can't not ask.
I appreciate that, and thank you for clarifying. Thank you, Mr. Chair.
Mr. Ott?
Thank you.
Okay, if you could, y'all could just remember to try to keep it at 3 minutes.
It's still better than the city council, so I appreciate it. Senator LaFleur, members of Senate Finance, I'm Brad Ott from New Orleans. Thank you for holding this hearing today. We have been able to listen to the eloquent testimony with regards to House Bill 1 appropriations, which disproportionately impacts those who need vital health care, social service, and welfare and education support. And I urge you to revisit it and rewrite it. As one who has personally received key support following a stroke I had from Louisiana Rehabilitation Services, I was able to return to the University of New Orleans, complete my BA and MA degrees, and for the past 3 years, I've served as an adjunct professor of sociology at Southern University of New Orleans, the Southern University College Connect program, and Delgado Community College West Bank campus. While over the last year and a half under John Bell Edwards and you all, we've seen some significant recovery from really the terrible devastation brought by the previous Jindal administration. And Medicaid expansion is a real benefit, and Alma Stewart really reflected my comments in that regard. But she also noted the looming federal retrenchment from Medicaid and other vital programs, and the fact that we really can't afford to do that now, and I really urge you to continue to fight back on that. I'll close out my comment with saying that as part of my sociological teaching to my students, I acquaint them specifically with this state legislature as a key political body to address our societal, human service, healthcare, and education institutions. I know he may have left, but I know he'll listen to this later. I want to personally thank Senator Bishop for speaking to my classes in this regard. He's really motivated students to get involved in an institution which otherwise wouldn't merit notice to them. That said, many of my students are in training for social welfare, social service, social work, public safety, and healthcare professions. Yet they're witnessing what's going on here. And frankly, they're challenging me to question just whom do you all serve? Are you just serving the powerful interests, those who always enjoy the tax breaks and get the privilege and get the incentives? Or is it the folks that really need all the support they can get? I'm here today in part to show that at least this committee has had a tradition of open process of public testimony from which you do deeply consider what happens to people's lives and how government is able to support them, give them a leg up to reemerge and be full citizens and people valued into our society. Yet House Bill 1, I'm just shocked at how damning it is to a lot of key programs, and I'm hoping that you reset the whole basis of the bill and begin to hold accountable those who have historically enjoyed social and economic advantage, because there are some areas I remain concerned. I know some of you on the committee have been strong voices for this, about a lot of the privatization that's gone on without accountability. And I hope that some of this accountability that can come up and be questioned. You know, there could be a lot of evidence that's presented as evidence-based, but if they're already enjoying delivery of services when really all they're doing is managing people, and then the services aren't available to be had for people who need them, there's a real problem, and there's a lot of unnecessary money that's spent. So thank you so much.
Thank you very much. Testimony like we hear today is a reminder of what our other role is here.
Well, and I hope to actually, I'll say this for my students, they'll be given the task this fall to view these hearings and critique and look at how things follow up. So thank you. Thank you for your help in that regard.
Send those reports to us so we can read them. Yes, ma'am.
I will.
I want to see the one on me for sure.
Chairman LaFleur, members of the Senate, thank you so much for taking my testimony today. My name is Janet Hayes. I started an organization named Healing Minds NOLA. I'm based out of New Orleans, Louisiana, that represents families of people with untreated serious mental illness who are otherwise not represented in any other organization, a la NAMI or MHA or other organizations with a lot of lobbying power. So I am one of many families. We're a loose group across the country who have experienced mental health and crises that have not been able to get help through the mental health industry. The mental health industry has largely abandoned people like me and our loved ones, consequently leaning on the corrections department and the criminal justice system. These very, very difficult people who sometimes don't want help, are treatment resistant, medication non-compliant. They fight getting care. Some don't even know they're sick, a condition called anosognosia. Our state spends, when I was going to, the 1 in 5, of course, as you know, people in America have a mental illness. But that means 1 in, how many are left in this room? About 40, so there may be about 4 people here today that have a mental illness. Earlier there were about 200, so there were about 40 people. I know we're looking around, and I have experienced mental health issues in my life. But those are largely mental wellness issues that do not require the same amount of intensive services as somebody with a serious mental illness. Mental illnesses such as schizophrenia, bipolar disease, clinical depression, when left untreated, can not only be dangerous to that person, but who could be at risk of suicide, but also to the general public. Person with untreated serious mental illness is 10 times more likely to commit violence than somebody who has treatment. So the risks in terms of, with how we think about people in the corrections department and mental health system, if somebody, someone who has schizophrenia who is regularly taking their medications and compliant with the treatment program are no less risky than you or I, outside of maybe a very unusual bout of anger or something like that. But somebody that's not is very likely to commit act of violence. So it's really important that we get these people help when we can, how we can. Our state spends far too much every year to criminalize mentally ill people or leave them rather than provide them with evidence-based treatment and services that produce positive outcomes. That's where our money is. Funding for SMI needs to shift back from the Department of Corrections and Criminal Justice System to health and human services and medical expertise. The mental health industry is the only industry that requires a person to commit a crime in order to access services. My friend and board member Eleanor Chapman, her daughter Chelsea Thornton, her mother, Eleanor, committed her to a hospital 3 times when she saw her decompensating in new trouble, and all 3 times the hospital let her out. Consequently, she took the lives of her children. She was arrested and is now in Orleans Parish Jail. She's been there for almost 5 years. It's an absolutely heartbreaking tragedy, and her mother says, my grandchildren are dead. My daughter's in jail and my life is shattered. Is she dangerous enough for you yet? And I always think of that, and these stories are heartbreaking. And Chelsea's been in jail because even though she was evaluated multiple times by psychiatrists who said that she was incompetent at the time of the crime, the DA is looking for an evaluation that will deliver a report to him that will allow him to put her in jail for the rest of her life. She needs to be in Jackson Forensic State Hospital. She's probably almost well enough to be released, step down into a group home. But again, her children are dead. That's a tragedy that's been very expensive, not only to the family, but for the state. Under no circumstances, the LDH, my phone, rather than cutting for mental health care in this year's budget, I urge your committee to retain funding, but require that DHH and LDH undergo a mapping process to provide the House and Finance Committees and citizens of the state with information about where they spend tax dollars and whether or not programs work. Under DHH spend millions every year on mental health, yet outcomes have been increased incarceration, homelessness, and death. It's time our leaders began listening to constituents. What guarantees do we have from LDH and DHH that ensure funding will go where it's most needed? And this mirrors what's going on at the federal level. The federal got $150 billion a year just on serious mental illness, and the outcomes have been increased incarceration, homelessness, and death. So up until a few years ago, and I really want to commend Representative Tim Murphy, who's a Republican out of Pennsylvania, our own Senator Bill Cassidy, and a Democrat out of Connecticut, for urging the Trump administration to maintain all funding for the Helping Families in Mental Health Crisis Act that was passed as part of the 21st Century Cures Act last year. Those reforms included HIPAA reform, reforms to protection and advocacy rights groups, more inpatient beds that didn't get passed, and assisted outpatient treatment, but we're going to continue to work to get more inpatient beds. And that's all documented in this book, Insane Consequences, that I urge you all to read, written by DJ Jaffe, How the Mental Health Industry Fails the Mentally Ill. What I'm talking about today is all documented in this book. I'm not going to bore you with the numbers and stats and data and statistics because it's all in here in the last third of the book. That's all it is appendices and resources that you can, fact check till you're, till you can't do it anymore. But so, and then I wanted to just say that I wrote it down so I wouldn't go over time, but I think I've already messed that up. That policy and funding redirection changes that need to happen in order for families like mine to get help for their loved ones are things like assisted outpatient treatment. And I know in Louisiana we have a very good AOT law, Nicola's Law, which is civil court-ordered treatment. It's where a caregiver, a social worker, someone who has a loved one with untreated serious mental illness that's been in and out of hospitals, maybe in and out of the jail, is non-compliant with the treatment plan that their psychiatrist, if they've seen a psychiatrist, has prescribed for them. And so a civil court judge can order that person to stay on their treatment plan with a team, an ACT team, a judge, a lawyer, the caregiver, the patient themselves. They all agree what the treatment plan should be, and the judge can order that person on the treatment plan while they live in the community, so it avoids expensive institutionalization. And but they still have to stay on their plan, and it works in 70% of the cases. And I'm really excited to say that I was able to participate in putting together a multi-parish team from Louisiana that's going to DC on June the 1st to do an implementation training that's been paid for by the federal government, and we'll bring that home and hopefully save the state a whole bunch of money on folks that otherwise would not seek treatment.
Right.
The other thing is, though, we're not there yet. We need more hospital beds. That's just the reality. That are in crisis, like Eleanor and like others that are in my organization, could have avoided a number of tragedies simply by being able to get their loved ones the long-term care they need. And then, of course, the post-crisis services are very, very, but we need a triage money so that the most money is going to the most sick rather than the other way around. Right now it goes to the most well, and it never funnels down to the most sick. So
I hate to cut you off, but your points are all very well taken. And
it's all in the book.
And we might get the book.
And he's wearing the prison reform because I really think the mental health industry and the corrections department should be speaking with one another. Because, if we're going to talk about reducing mass incarceration and saving money and reinvesting those savings, if we have 60 to 70% of people in a jail has a mental illness, how can we talk about reducing mass incarceration unless we have the Department of Mental?
We've been talking about it seriously, and we have actually passed some bills. Like I said, it's baby steps, and we're getting there.
And I've been a part of that as well, but I was going to finish by saying without the behavioral health department sitting at the table, they need to be talking to each other more, and they're not.
Okay. I appreciate your testimony today, Ms. Hayes. We're going to move on to the next group here.
Thank you.
The last group of the day. Thank you. Matthew, we already did Matthew. Desiree Brar and Raquel Estevan. Raquel, are you Raquel? No, that's Raquel. Raquel, you were the last person called, so you win a free trip to Hawaii for a week. Senator Alario has a gift certificate for you up in his office. So, and if you just talk to me about it next week, and I'll get that for you.
Thank you, Mr. Chairman. I appreciate that. Good afternoon, Chairman.